Hello, my name's Olivia.
My name's Lizbeth.
My name's Jasmine.
And our topic is Dr. Lillehei and open heart surgery. I understand the risks of the surgery are extremely high, but I'm still a little hesitant.
Cardiac surgeries have lower risks now because of Dr. Lillehei, who specializes in cardiac surgery. I think if you were to research him, you'd feel more assured with the procedure.
Okay, I'll look into it, but could you tell me about him now?
Sure. Dr. C. Walton Lillehei was a doctor from the mid-1900s. He died at the age of 80 on July 5, 1999, leaving behind a legacy. He led an evolution in medical history by participating in the very first successful open-heart surgery. Because of his discoveries, we now have efficient and reliable options for cardiac surgery. He saved the lives of many by his medical work and discoveries.
We need to find a solution fast. The patient keeps getting worse.
There's nothing we can do. The patient needs a heart surgery, but there's no way to perform on the heart without it being exposed.
We've had many cases like this in the past, but the patient rarely survives.
Yes, I wish there was a way we could operate on the heart.
I agree, but there's nothing we can do. We should just do what we can do now.
In the early to mid-1900s, there was no way of operating on the heart. A lot of people died because they needed a surgery that had not yet been discovered. Patients had little to no options for treatment. Doctors did not know the cause for heart attacks and heart disease until 1946. They discovered that it was what they were eating. The only options for treatment they could give their patients were to eat less food, eat more vegetables, and drink more milk. They did not know what was healthy to eat and what was causing the problem.
I just reviewed your blood work, and it looks like you have heart disease. There aren't very many options for treatment, but what you can do is eat more vegetables and drink more milk.
I don't understand. How could I have heart disease?
We have done more research and found that heart disease is strongly linked to what we're eating. Eating more vegetables and drinking more milk should slow the progression of the heart disease.
Okay. Thanks, Doc. I'll start eating more vegetables. My whole family will. I don't want to risk them getting sick. Dr. Lillehei discovered that there was a way to pump blood through the veins of a patient by connecting them to a machine that performs cross-circulation. However, he was not the first one to attempt this theory. He had gotten the idea from a German doctor who performed experiments on dogs by connecting them to tubes and seeing if he could open up their hearts and have them survive.
Right this way, ma'am. You may take a seat. I have recently been experimenting with the surgery. It has not yet been attempted on humans, but it has worked a number of times during the experiments.
This sounds a little risky. Is there any other way?
Yes, it is risky, however, there is no other way. I'm sorry, but this is the only option we have.
Well, I guess if this is our only option, we'll have to take the risk.
Dr. Lillehei had participated in the very first open heart surgery. It was led by Dr. F. John Lewis, March 26, 1954. It was performed on a 13-month-old child named Gregory. Gregory had a birth defect that caused his heart not to function properly. Open heart surgery gave Gregory and other kids like him a second chance.
We only have a 10-minute window provided by the hypothermia.
Nurse, scalpel.
Clamp.
Hello, my name is Dr. Lillehei. I participated in the very first open heart surgery. Open heart surgery is a surgery to clear the heart and or lungs of fluids or fats that are preventing it from functioning properly. I'll tell you a little more about the procedure. Controlled cross-circulation is used for achieving total bypass of the heart and lungs. We lower the body's blood flow by lowering the body temperature to cause the patient to have hypothermia, but not enough to cause permanent damage to the body. We lower the patient's blood flow to 1/6 to 1/4 of the original resting heart rate. We do this because we need to be working with a blood-free intracardiac operating field. This reduces the amount of blood returning to the heart. For my first patient, it took between 6 and 21.5 minutes for the heart and lungs to be totally bypassed. During the procedure, it is extremely important to monitor the body's temperature. An electric blanket is placed beneath the patient in order to prevent the hypothermia from killing them. We then proceed to make an incision in the chest in order to reach the heart. The surgery is used for cardiac and pulmonary bypass. It's also used for birth defects in young children. We are happy to tell you that your son has survived the surgery.
Thank you so much. I knew it was worth the risk.
This is a huge breakthrough in medical history.
This was the first open heart surgery in the world. It left a huge legacy in history. However, sadly, 11 days later, Gregory had died. His death was due to pneumonia caused by fluid leaking into his lungs during the surgery.
Nurse, the patient needs open heart surgery right away.
Okay, I'll prepare the tools.
Scalpel. Clamp. Forceps. Sponge. Sutures. Gauze.
This was the very first successful open heart surgery performed in the world. It took place on September 2nd, 1952 at the University of Minnesota. The patient had cardiac bypass surgery to clear their heart valves. The patient's disease had been cured and they survived.
After the surgery was released to the press, everyone had praised Dr. Lillehei. He was given all the credit for the surgery and he became a very famous doctor. Open heart surgery was one of the most common surgeries in the mid to late 1900s. It saved the lives of many children and adults.
Over 600,000 people in the U.S. have heart disease and need cardiac bypass surgery. Thanks to Dr. Lillehei, we now have a successful way to treat those patients. Dr. Lillehei left a legacy in history because we still use the procedure that he discovered today.
So how was your day, honey?
It was okay, but I felt a little tired.
Oh, I'm sorry. We're ready.
So what seems to be the problem?
She's just been feeling very sick. She's not acting like herself and she gets tired very quickly.
All right, we will do blood tests to see if she has diabetes or heart disease.
What's diabetes?
Diabetes is a metabolic disease in which the body's inability to produce enough or any insulin, which is a hormone that stabilizes the sugar in your blood, causes elevated levels of glucose in the blood. In 2012, 29.1 million Americans, or 9.3% of the population, had heart disease and need cardiac bypass surgery.
In the 2008-2009 annual case of diagnosed diabetes, it was estimated at 18,436 with type 1 diabetes and 5,089 with type 2 diabetes.
Diabetes is strongly linked to heart disease. About 610,000 people die of heart disease every year in the United States. That's 1 in every 4 deaths. Thanks to Dr. Lillehei, we now have a more effective way to lower these numbers and prevent many deaths. Wow, Dr. Lillehei left a huge legacy in medical history. I'm so thankful for the fact that he took such a huge leadership role in his legacy and surgery.
Yes, he was a great leader. Did you know that Dr. Lillehei worked with Earl Bakken and inserted the first pacemaker?
That's incredible! It sounds like he did a lot of amazing work with his life.
Yes, he did. I admire his leadership very much. He inspired me to become a doctor. Dr. Lillehei led the research and discovery to an evolution in medical history. He created a way to perform what is now called cardiac bypass surgery. This legacy is survived today by his 3 sons, 2 of which are deceased, his daughter, and his many grandchildren.